This is part 2 of non-Medicare health plan rating methodology for the San Francisco Health Service System and Health Service Board. Total cost rate segmentation into employer and member contributions. As reviewed in part 1, this discussion provides information to the Health Service Board of the San Francisco Health Service System, as well as other interested parties, regarding how health plan rates are set for SFHSS health plans for the active employee and early retiree populations, also known as the non-Medicare populations. My name is Mike Clark, lead actuary for Aon's engagement with the Health Service Board and San Francisco Health Service System. This was prepared and delivered via recording in early April 2020. This discussion has emerged to address periodic questions raised by Health Service Board members, as well as in public comments during HSB meetings, about the relationship of health plan rates across active employees versus early retirees within a plan, by dependent coverage tier, single, two-party, and family within a plan, and across health plans offered by SFHSS. As reviewed in Part 1, this is the end state, the 2020 monthly rates and contributions for the 5 health plans, and within those the 3 dependent coverage tiers offered through SFHSS. This is shown for 2 major population segments, active employees and early retirees, where this particular chart illustrates active employees for the City County of San Francisco employer, as well as early retirees earning the full employer contribution based on hire date. Part 1 addressed how Aon for self-funded and flex-funded plans and the health plans for fully insured plans perform rate-setting activities for next year's health plan rate recommendations. This Part 2 will cover how total cost rates are segmented into employer and member contributions for each population segment, active employees and retirees. And then future parts 3 and 4 will cover the historical perspective on SFHSS health plan rate relationships across health plans and dependent coverage tiers, given the historical influence on current methodologies, concluded with current state of SFHSS health plan rate relationships across health plans and dependent coverage tiers. So let's begin Part 2, total cost rate segmentation into employer and member contributions, including separate discussions for active employees and retirees. We'll cover Part 2A first, segmenting total cost rates into employer and member contributions for active employees, with a review of the allocation methodologies for all employers in SFHSS. We start with the City County of San Francisco, where medical, prescription drug, and core vision employer contributions are based on negotiated percentages by dependent tier. For some employee groups, it is 100% for single tier, 96% for the two-party tier, and 83% for the full family tier. And for other employees, it's 93% for single, 93% for two-party, and 83% for full family. And this applies to most plans. For the medical, prescription drug, and core vision plans, the employer contribution dollar amounts for the most expensive plan, in this case the UHC City Plan PPO, are the same as those for the second most expensive plan, which happens to be the Blue Shield Access Plus plan. Otherwise, employer contributions for health plans other than the most expensive plan are guided by these negotiated percentages above. And then employee contributions for the health plans become the total cost rates less the employer contribution amounts for each plan and tier. For dental plans, CCSF employees pay $5 per month single, $10 per month two-party, and $15 per month full family for the Delta Dental PPO, and they pay no contributions for the two dental HMOs. An employee selecting the VSP Premier Plan, in other words the buy-up plan, pay an incremental contribution equal to the difference in the total cost rates between the VSP Premier Plan and the VSP Core Vision Plan for the dependent tier selected. Next, we address the San Francisco Unified School District, or SFUSD. The medical, prescription drug, and core vision plan employer contributions for the employee-only tier vary by plan and tier. They're anchored to the 10-county amount at minimum, but could be higher for a given employee segment and/or plan depending on agreement. And we'll cover the 10-county amount later in this presentation. It is based on a survey that is performed in the spring every year of the 10 most populous counties in California outside of San Francisco. For Kaiser, the employee-only employer contribution equals the premium, since the Kaiser premium is less than the 10-county amount. The medical, prescription drug, and core vision employer contributions for the employee plus one and employee plus two or more tiers vary by employee type and plan based on agreements with each employee segment. Generally, the employer contributions for family tiers will increase proportionally with total rate increases each year. The employee contributions for these health plans then become the total cost rates less the employer contribution amounts for each plan and tier, and the number of pay periods for a given SFUSD employee in a year can vary by the type of employee. SFUSD does not elect to offer dental through SFHSS, and similar to our discussion on CCSF employees, the SFUSD employees selecting the VSP Premier Plan pay an incremental contribution equal to the difference in total cost rates between the Premier Plan and the Core Vision Plan for the dependent tier selected. Next, we discuss the City College of San Francisco employees, or CCD. Similar to SFUSD, the medical, prescription drug, and core vision plan employer contributions for the employee-only tier do vary by plan and tier, anchoring to the 10-county amount at minimum, but could be higher for a given employee segment and/or plan depending on agreement. And Kaiser has the employee-only employer contribution equal to the premium, since the Kaiser premium is less than the 10-county amount. The medical, prescription drug, and core vision plan employer contributions for the employee plus one and employee plus two or more tiers vary by employee type and plan based on agreements with each employee segment. Generally, employer contributions for family tiers will increase proportionally with total rate increases. Then the employee contributions become the difference between the total cost rates less the employer contribution amounts for each plan and tier. Where similar to SFUSD, the number of pay periods for a given CCD employee in a year can vary by type of employee. CCD does not elect to offer dental through SFHSS, and similar to the other employee groups, the employees selecting VSP Premier Plan pay an incremental contribution equal to the difference in those total cost rates between the Premier Plan and the Core Vision Plan for the dependent tier selected. Superior Court employees, most pay no contributions for medical, prescription drug, and core vision coverage, and the Superior Court employees pay no contributions for dental coverage. And similar to the other groups, employees selecting the VSP Premier Plan pay the incremental contribution difference between the Premier Plan and the Core Vision Plan rates for the dependent tier selected. And the Municipal Executive Association employees. The employer contributions for MEA include two sources for the medical, prescription drug, and Core Vision Plan. The first source is flex credits, which can be spent on a variety of pre-tax and post-tax benefit options, including healthcare, paid via payroll deduction. Credit amounts vary by MEA employee type and by dependent coverage tier for CCSF and MTA employees. The second source is employer contributions equal to the 10-county amount for CCSF and MTA employees enrolling in employee-only or employee plus one tier for medical coverage. Kaiser contribution is less than the 10-county amount given lower premiums for Kaiser. For dental, CCSF and MTA MEA employees enrolled in the Delta Dental PPO plan pay $5 per month single, $10 per month two-party, and $15 per month full family for coverage. All other plans have no contribution. Superior Court MEA employees pay no contributions for any dental plan. And employees selecting the VSP Premier Plan pay an incremental contribution equal to the difference in total cost rates between the Premier Plan and the Core Vision Plan for the dependent tier selected. We'll now transition into discussion in Part 2B, segmenting total cost rates into employer and member contributions for the retiree populations. The employer contributions for retirees are guided by city charter formula. For retirees hired on or before January 9, 2009, medical, prescription drug, and Core Vision Plan employer contribution amounts are based on three components as defined in the city charter, two of which are developed separately for each plan. The element that is the same for all plans is the 10-county amount that we discussed earlier, which is determined by annual survey, and the same dollar amount for all plans and dependent tiers applies. The first element that varies for each plan is the actuarial difference, which is the difference between the single tier premiums for early retirees and the single tier premiums for active employees within a given plan. The dollar amounts vary by plan, but within a plan, the same dollar amount applies to all dependent coverage tiers. And the second element that varies for each plan is the retiree Proppy contribution, which is 50% times the difference obtained by taking the total cost rates less the 10-county amount and less the actuarial difference. This calculation is performed for both the retiree-only tier and the retiree plus one tier, where the dollar amounts vary by plan, and within a plan, there is an amount for the retiree-only tier, and then the amount that's calculated off the retiree plus one tier also applies to the retiree plus two or more tier. So this is an illustration that shows one plan, the Blue Shield Access Plus in this example, and how these three elements of the city charter employer contribution formula illustrate into the amounts that factor into the employer contribution for the Blue Shield Access Plus plan. The light blue amount is the 10-county amount, which is the same dollar value for each plan and across each dependent coverage tier, as you see in this illustration for retiree only, retiree plus one, and retiree plus two or more. The dark blue portion of the bar is the actuarial difference, which is plan specific and is the same amount for all tiers based on the difference between the retiree only rate and the employee only rate for a given plan. And then the tan or the gold bar, is the retiree Prop E contribution, which is plan specific but does vary between the single tier and the two family tiers. So from this illustration, we'll go to the next slide and illustrate this information for the 4 primary plans offered to retiree populations, early retirees, and SFHSS. The upper left is the Blue Shield Access Plus plan. The upper right is the Blue Shield Trio plan. The lower left is the UHC PPO City plan. And the lower right is the Kaiser HMO plan, all offered to early retirees. And as we discussed earlier, you will see that the light blue portion of the bar is the 10 county amount, which is the same for all plans and all tiers. But the dark blue actuarial difference and the tan retiree Prop E contribution amounts do vary by plan, and for Prop E vary between the single tier and the 2 family tiers. For retiree plans with no retiree contributions, for retiree only tier in 2020, for retirees hired on or before January 9th, 2009, there are certain plans where the employer contributions are limited to being no more than the cost of retiree only coverage. This applies in 2020 for the following plans: the Kaiser HMO for early retirees, the Kaiser Permanente Senior Advantage or KPSA plan for Medicare retirees, and the UHC Medicare Advantage PPO plan for Medicare retirees. This is why each of these plans listed above have no retiree contributions for the retiree only tier in 2020. All other early retiree plans have some level of retiree contribution for the retiree only coverage in 2020, including the UHC PPO City Plan and City Plan Choice Not Available, as well as the Blue Shield Access Plus and Trio HMO plans. For retirees hired on or after January 10th, 2009, the medical, prescription drug, and vision employer contributions vary by years of service. For those with at least 5 but less than 10 years of service, there is no employer contribution. The coverage is fully paid by the retiree hired on or after January 10th, 2009. For those who have at least 10 but less than 15 years of service, based on this hire date, 50% of the employer contribution amounts provided to retirees hired on or before January 9th, 2009 becomes their employer contribution. At 15 to 20 years of service, it becomes 75% of the full employer contribution amount for those hired on or before January 9th, 2009. And with at least 20 years of service, those who were hired on or after January 10th, 2009 earn the same employer contribution amount as retirees hired on or before January 9th, 2009. And we conclude this part 2 on segmentation of total cost rates into employer and member contributions for the retirees with a discussion of dental and vision. Dental coverage for all plans offered is fully contributory, so there is no employer contribution for all retirees. And for the VSP Vision Premier Plan buy-up coverage, it is fully contributory, no employer contribution for all retirees. So this concludes part 2, our discussion of segmenting total cost rates into employer and member contributions.